All right, everyone, we are going to go ahead and get started. We do appreciate everyone jumping on and taking time out of their day for this presentation. I'd like to quickly introduce tonight's presenter. It's Dr. Ajib, urologist with Albany Urology Clinic. He earned his medical degree from University of Balaman, completed his residency in urology at St. George Hospital University Medical Center. He has a fellowship in minimally invasive and robotic surgery at the University of Montreal. He's been in practice with Albany Urology for 4 years. Um, he's has numerous publications in peer-reviewed journals. He specializes in overactive bladder, enlarged prostate, and advanced prostate cancer. Um, there will be an opportunity towards the end for questions. There is at the bottom of the screen a Q&A tab where you can put your questions in, and those will be answered towards the end of this presentation. There will also be a quick poll towards the end as well for everyone to fill out. Dr. Ajib, I'll turn it over to you.
Thank you, Chase, and hello, everyone. Thank you for attending today's presentation about a very important and very common topic, overactive bladder. So many of you might have been having these thoughts, feeling overwhelmed, exhausted, concerned, but they're too embarrassed to talk about bladder or bowel control issues. And it's estimated that 44% of the people are embarrassed just to talk about bladder control problems. And more than 50% of people diagnosed or who have overactive bladder didn't even discuss it with their doctors yet. So this often prevents people from getting the help that they do need. Now, I'm sure that these descriptions might sound familiar to some of you, like, will I ever be able to take my grandkids for lunch, for example? Will I be able to enjoy like a whole baseball game or enjoy a good night's sleep? So bladder and bowel control problems can really have a significant impact on the quality of life, and it might prevent you from going to certain places or doing things that you like. So we're here to let you know that there are treatments for bladder and bowel control problems, and we're going to go through it in detail. So this is a very common, like bladder and bowel control problems are very common. And for example, it's more common than vision problems and diabetes, two conditions that most of you think are extremely common. So in the United States, it is estimated that 1 in 12 US adults do suffer from bowel control problems. That's close to 21.4 million. And in regards to bladder control problems, it is estimated that around 43 million adults do have bladder control problems. Now, you will ask yourself, like, if they're that common, why haven't I heard about it up till now? One is because of the reason I mentioned before, like embarrassment. People like don't mention it to their doctors and don't like to talk about it. And at the same time, most of the people have the self-manage. Like, for example, they drink less fluids, they even like wear pads or even restrict their social activities. So like vision problems and diabetes, bladder control issues can happen at any age, but they are more common in elderly people. Now, ignoring such like bowel or bladder control problems can lead to loss of sleep, loss of the self-confidence and self-esteem, and poor feelings about the general health. So for like we're doing this presentation again to let you know that we're here to help, and there are several treatment options. So what causes bladder and bowel control problems? It could be, again, the daily habits, for example, related to what we eat or what we drink. If we drink lots of coffee, tea, certain medications that we're on, or even like some supplements. Also, it could be related to previous like pelvic floor injuries, previous surgeries, childbirth, and pregnancy. Now, before we talk about treatments, I would like to explain a little bit about how does the bladder, like how is the bladder being controlled by the brain? Because this is very important for us to understand the treatment later on. So usually as the bladder fills up, it will like nerve signals are being sent to the brain that the bladder is full. And the brain, through those nerve signals, will give the order to the bladder to empty itself, as if you're squeezing a balloon, for example, to empty all that urine. And now in patients who have those bladder control problems, there's certain miscommunication between the brain and the bladder. So it happens as the bladder starts to fill up, the brain is already giving those signals to the bladder to empty itself, and thus patients will develop those overactive bladder symptoms, like with the urgency and frequency going to the bathroom. The same thing with the bowel control. Like bowel control works by, again, like there is a coordination between the digestive system and the brain, and there is that delicate coordination, if I would say, and the digestive system and the intestines work by moving the food through all the digestive tract, and that usually takes between 24 to 72 hours through certain muscular contractions in the intestines. So as the rectum fills up with waste, again, the brain will receive those nerve signals and will give the order to the anal sphincter to relax, and then we can get rid of that waste. And same thing with the bowel control, like if we have that, like we don't have that proper coordination, then that also like leads to bowel incontinence and fecal incontinence. Now, there are three common types of bladder control problems. I'm going to talk in detail about each of those. You have the stress incontinence, you have urinary retention, and you have overactive bladder. So to start with stress incontinence. Stress incontinence is usually related to weakened pelvic floor muscles. Could be just age-related or could be related to certain surgeries, for example, like uh, like many postmenopausal women do suffer from stress incontinence, again, because of the weakened pelvic floor muscles. And also men who have, for example, who previously had radical prostatectomies, which is a procedure for prostate cancer, also can suffer from stress incontinence. And usually leakage of urine will happen if you cough, if you sneeze, if you laugh, or just with minimal physical activity. And usually the treatment of stress incontinence is related to certain pelvic floor, like physiotherapy, Kegel's exercises. I'm going to talk about those in the coming slides. So, and if those failed, usually it's surgical intervention with certain procedures. And nowadays also we have certain medications that we can inject in the urethra to help with stress incontinence. Coming to the next or the second type of bladder problem or bladder control problem is urinary retention. And this can be really frustrating. And it is a problem where we cannot tell when the bladder is really, really full. And usually the treatment of urinary retention is placing a Foley catheter. So patients will have a tube to drain the catheter to get rid of all that urine and that retention. And it could be related to anatomical obstructive pathologies, or it could be related to just like neurogenic bladders or non-obstructive causes. The most common type is overactive bladder. And unlike stress incontinence that I mentioned before, overactive bladder has very little to do with support. And overactive bladder is defined with one of the following symptoms. If you have, for example, like urge incontinence, for example, you feel that you want to go to the bathroom and you have to go. You got to go to the bathroom right away. And if there was no facility right next to you, that can lead to incontinence or leakage of urine. The second symptom is urgency or frequency, where men or women can go to the bathroom like more than 8 to 9 times per day, no matter how much fluids do they drink. And again, that can affect their day-to-day living. And the third thing also like that we also do experience with overactive bladder sometimes is what we call nocturia, which is two or more visits to the bathroom overnight. And of course, that can disrupt your sleep cycle. Now, in regards to fecal incontinence, and that we have two different types. We have urge incontinence and we do have passive incontinence. Urge incontinence, which is the inability to resist that urge to go to the bathroom, and passive incontinence is an ability to feel when you need to go to the bathroom. And again, same thing with the bladder control problems that can limit our daily activities and really affect our day-to-day living. Now, coming to treatments. So we did talk about all the different types of those bladder and bowel control problems. Now, treatment. We have three different treatment options. We start first with the lifestyle modifications, then we go on to the oral medications, certain medical therapy, and then advanced therapies. So let's start with lifestyle modifications. So with lifestyle modifications, again, patients are given certain behavioral modifications. For example, in regards to their diet, they're asked to reduce their intake of caffeine, like coffee, tea, even like spices in food or soft drinks. And that can help a little bit, again, with that urgency and that frequency going to the bathroom. And also other stuff, like I mentioned, for example, like Kegel's exercises, which are certain pelvic floor muscles to strengthen that pelvic floor. Also, these can help a little bit patients suffering from stress incontinence or overactive bladder. And another thing that can also be mentioned for the patients is, for example, is scheduled voiding. Patients will be asked, for example, to go to the bathroom every 3 hours, like to have like a certain schedule for those bathroom visits. And another thing that can help them sleep, like have a good night's sleep, is, for example, abstaining from water intake or any fluid intake 3 hours before bedtime. Now, those behavioral modifications do fail and the patients are still suffering from overactive bladder symptoms, we go onto the next step, which is offer some medical therapy. So we do have two categories of drugs that can be offered. We do have the anticholinergics and the beta-3 agonists. These are medications that are taken on a daily basis, and they can help with the symptoms of like urgency and that frequency going to the bathroom. But the problem is that, again, they might have their side effects, and this can lead to dry mouth, blurry vision, constipation, hypertension, like increase your blood pressure, and several other possible side effects with taking these medications. And in one of these surveys and studies, it was estimated that 72% of people say that they stop taking those bladder medications within 6 months. And that could be related to the side effects, could be related to the cost of the drug, or just not like didn't see any improvement in their urinary symptoms. So, and this is also like an important slide where only 20% of patients like with overactive bladder were satisfied with their current treatment just being on medical therapy, and that's considered to be a very low number. And close to 82% of overactive bladder patients are not adherent to taking their medications during that period of 12 months. And also, like another survey and study showed that 60% of the patients do not return to their visit after their initial appointment, and more than 90% of those patients do not return after their third appointment. And again, that is because of them not being satisfied with just the oral medications. So here comes the era, like the advanced therapies. So again, behavioral modifications do fail. We went to the medical therapy, and if that fails, then we offer those advanced therapies, which can really have a great impact on the patient's lifestyle, if I would say. So in regards to the bladder control, we do have the Medtronic InterStim systems. Again, I'm going to talk about those in details. We do have the Medtronic neurosystems, or we do have injected medications in the bladder. And as for the bowel control, we do have the Medtronic InterStim systems and some surgical options that can be offered after that. So let's start with the injected medications, so Botox. So that is, again, for patients with overactive bladder having that urgency, frequency going to the bathroom. One of the treatment options is to inject Botox. And we do that like it's a procedure that usually is done like with minimal sedation or under general anesthesia, where we go in with a scope, which is like a camera that goes into the bladder, and we inject that Botox, that medication, in random spots in the bladder. But the problem with Botox is that this treatment is usually required to be done every 6 months, usually. And it can have its side effects. So some patients can suffer from retention of urine after those injections. That means that they won't be able to pee. And that sometimes can require placement of Foley catheters or doing even self-catheterization 2 or 3 times a day for a period that can last up to 6 months. And one study did find that 67% of the patients discontinued treatment with Botox after their first injection only. And so that's why we have those other treatment options that we offer to our patients to be able to better help them and for them to see like more improvement in regards to their urinary symptoms. So one of them is the percutaneous tibial neuromodulation. That is one type of like of a treatment that stimulates the tibial nerve, and that is a nerve like that's located just above your ankle, and it's supposed to restore that bladder function. This is a weekly treatment that lasts for 12 weeks, and then after that you have monthly maintenance sessions. And each treatment is usually can last up to 30 minutes. The other treatment option, which again, patients reported major improvement with, I'm going to give you like exact numbers in the coming slides, is what we call the sacral neuromodulation, or the Medtronic InterStim system. Let me explain how this system, like just to simplify it. Imagine like you having dinner outside, like with your partner, and you're having that dinner in a busy restaurant. You will have difficulty communicating with your partner because of all the noise around you. And so that is the same thing that happens between the bladder and the brain. You have all those signals coming to the bladder that could lead to that urgency and that frequency. So the aim with that sacral neuromodulation, that Medtronic system, is to get rid of all that noise so that we can restore that proper bladder control coordination. And that is the only treatment that specifically works on that coordination between the brain and the bladder. And again, I'm going to go into details about how does this, how is it being done, if I would say. So again, and a very important thing that I would like to mention here is that this sacral neuromodulation was the only advanced therapy that was shown to be superior to medical therapy. And the good thing about it is that we do have a test. So it lets you test it first. And that is called a P&E testing, which is like a simple procedure that is done as an outpatient procedure that can take like from 5-10 minutes or up to 15 minutes, and can be done under just local anesthesia. Again, it's a same-day procedure. So you come to do that procedure, we stimulate those sacral nerves, and we leave the wires in. And then the patient will present to the office like a couple of days after, and the patients will let us know that they did notice that improvement in their urinary symptoms, like more than 50% improvement in their urinary symptoms. And at that time, we go on and schedule that placement of that permanent device, that InterStim device. So again, it's a treatment that lets you test it first. So we test it, it shows that it's efficacy, it's working. Then we go on to the next step to place that permanent device. So over, like, again, 375,000 people worldwide have used that therapy, and the numbers are growing even like much more than that. Again, it's a very small battery that we do implant in the buttocks area. Again, it's a very simple procedure that can also be done under local anesthesia. We can do it under local or under general anesthesia. And it's a quick, again, same-day procedure that we implant it, and that will give really a relief, and patient will notice like a major difference in regards to their urinary symptoms. And after that procedure, you can go back to your regular activities like within a period of 14 days. And nowadays we do have like the non-rechargeable batteries. So we place that device and that can last for up to 10 or 15 years. So you don't have to worry about anything. When you come for your post-op visit, we set the program for you, the best program that suits you, and then you just forget about it. You just go and enjoy living without having to go and think about the bathroom all the times, wherever you go. And it's estimated, and one of the studies showed that over 80% have achieved success within that period of 5 years. And also, like, a very important thing, like, some people would be concerned, like, if you're putting a device in me, like, would I be able to get MRIs, for example, like those type of scans after that? Yes, there won't be any contraindication. Whenever, if your family doctor or other specialties recommended you getting an MRI, it won't be a problem. So you don't have to worry about anything. These devices are MRI compatible. And also, like if you're traveling with those metal detectors for like at the airports, again, that is not a problem. Like it's like any other patient, for example, having a pacemaker or anything like that. So it won't be a problem for you to be concerned about. And So in the last slide, you'd ask yourself now, is this therapy right for me? So if you're suffering from the symptoms that we talked about before, like you suffered from the urgency, that frequency going to the bathroom, or even the bowel control problems like that, incontinence, and so you do have those symptoms. You tried all the behavioral modifications, you tried the medical therapy, and those failed, then yes, this is the treatment for you. And you will see like a major difference with those symptoms. And like to give you like exact numbers, 84% of the patients were satisfied in regard to their bowel control with these types of advanced therapies, and 3 times greater improvements in the quality of life when we compare it to other patients who are just on medical therapy. And again, 89% of the people using Medtronic bowel control therapy experienced long-term success. So again, if you're having those problems, please don't hesitate to give us a call at the office and we'll be more than happy to help you. No referrals are needed. You just call the office and again, we'll be more than happy to help. We offer, again, we'll discuss all these treatment options in detail with you and we're here to help. So again, thank you so much for attending today's presentation. Now, if there are any questions, I'll be more than happy to answer those. And again, I would like to thank you all for attending today's presentation about this common topic.
Thanks, Dr. G. Yeah, we did have a couple questions come through, and for everyone on the presentation, as a reminder, please fill out the poll you see on the screen.